Hello, my name is Madison Sadler, and today I'm going to be talking about my internship. So this is my PBH 497 final internship presentation. So the agency that I interned at this semester was called St. Mary Health Center. It is in downtown Wilmington, and its mission and goal is to provide medical and dental services to underserved populations. The structure of St. Mary is that there's one paid employee who is the clinic director, and then there's volunteer admin, dentists, doctors, and assistants. So these people volunteer their time and help the clinic run. There is one lady that comes in about 3 or 4 times a week to answer phones, do admin things of that nature. And then dentists, doctors, and assistants come various times throughout the week to provide services. So the funding for St. Mary is basically all funded by grants and then some private donations. So the big grant that funds St. Mary is from the Rotary Club, actually. And then private donations from individuals, and then also churches, religious organizations, things of that nature also make up a good portion of the funding. So as I mentioned, St. Mary serves underserved populations. And what I mean by this is it's basically uninsured individuals whose income falls 200% below the federal income poverty level. So these people can't have Medicaid, Medicare, or any other type of insurance, and they also have to fall below that income poverty level based on number of people in their household, how much they make, things of that nature. So as I mentioned, dentists and doctors volunteer their time to provide services. There's actually only one doctor right now who is able to volunteer. So there's limited medical clinics that are happening only once a month. Does the doctor come in? But he typically brings medical students with him that are doing their rotations with them, and then also volunteers help as well with things like assisting and other things. And then dentist, there are 3 dentists that are coming regularly. So there's one that comes on every 3rd Tuesday, one that comes every 3rd Wednesday, and then one that comes every single Friday morning. So as I mentioned, these people are giving up their time that they could be working and providing these services, typically outside of their practice time. So after they get off work, they come in, or taking time off of their practice to volunteer, which is very generous, and we really appreciate that. So as I mentioned, there's one paid employee at the clinic, and that is Laura Vincent. She wears a lot of hats. She does a lot of things, but mainly her title is clinic director and outreach coordinator. As I mentioned, she wears a lot of hats. She does a lot of things, and yet the clinic wouldn't run without her. So now I'm going to move into talking about my internship experience at St. Mary. I absolutely loved my time at St. Mary. I thought it was incredibly just educational. It was fun. It was never a dull moment. It was me and one other public health intern at St. Mary at the time. And then also there were 2 exercise science interns as well. So we had a lot of fun. We got to kind of see the exercise science portion of things, as well as the public health sort of stuff. So it was incredibly helpful. So as I mentioned, there are a lot more dental clinics that are happening right now than medical clinics. And so because of that, a lot of my daily responsibilities or weekly responsibilities were mainly related to the dental side of things. However, some of them were medical. So some of these include triaging patients at clinics, so doing things like blood pressure, weight, seeing which tooth is bothering them, because I didn't mention this, but the thing that we mainly do at these clinics is extractions. So they don't really do cleanings or fillings. It's mainly extractions, wisdom teeth, other teeth that are bothering them. So finding out which tooth is hurting them, things of that nature. And then at the medical clinics, doing things like blood glucose levels or getting medical history, things of that nature, finding out what medications they take. So moving on, so setting up procedure rooms is another really important part of what I was there to do. And so I made sure the dentists and doctors had the instruments that they needed, the tools, the anesthetics, just anything that they could need in that room to provide their service. I was in charge of making sure that they had it. And then also for medical clinics, taking notes for physicians while they were in the room with patients. So not only did I get to kind of write down what was going on, but I was taking in things. I was learning how doctors kind of deduce what's going on with the patient and make a diagnosis. So that was really cool. And then also for dental clinics, I got to assist with dental procedures, which was awesome. I didn't know how I was going to do with the blood and the teeth, but I did fine. And so, yeah, assisting with dental procedures was incredibly informative and educational because I got to learn so much about dental anatomy and different things that can go wrong and how that affects the rest of health and like of the human body and things of that nature. So it was really cool to be able to do. And then also one other important thing that maybe wasn't as glamorous, it was cleaning procedure rooms, sterilizing instruments. Sterilization is incredibly important, and getting to learn how to do that properly was very cool. And I really enjoyed it, actually. So mainly my time was spent doing those weekly clinics, preparing for those, getting things set up, and then actually helping with the clinics. But another project that I worked on was a pediatric dental clinic series. So basically over 2 months, a month and a half, every other Saturday, we would hold dental clinics for pediatric patients. And these mainly did just exams, x-rays, cleanings, things of that nature. So no extractions at this point, just cleanings and exams. So for this, I got to work with planning and promoting and then executing these clinics as well, which was really, really awesome. And it was an amazing experience. I got to kind of be on the admin side of things at that point. So for my internship project, my approved project were post-op care posters in English and Spanish. So when I came into the clinic, I noticed that a lot of the posters or educational materials that were at the clinic, they weren't in Spanish, if there were any. But there was a lack of educational materials in both languages. So I knew that that's something that I wanted to provide, because providing information about post-op care is incredibly important for the health of the individuals that are receiving the care, because you don't know what you don't know. And so to prevent dry sockets and just trauma to that area, it's really important for them to know what they're supposed to do after their experience with getting their tooth pulled, or teeth in some cases. So yeah, I researched and created 2 posters with extensive post-op care information. Both posters say essentially the same thing. One's just English and one is in Spanish, as you can tell. And I posted them around the office and actually put like a miniature version in their post-op care pack. So the impact of this is hopefully that they are reducing people coming back with problems from their extractions. So these are the public health domains that I think I accomplished. First is number 2, foundations of biological and life sciences, just basically learning the basics of dental anatomy, treatment and care. Number 5 was identifying and addressing population health challenges. So discussing lifestyle changes with patients that will positively influence their health status as well as their families as well, so we can make a change in the greater population. Number 6 was human health. So helping educate patients on pre and post-op information and care procedures. Those posters help do that. And then also using triage skills such as blood pressure readings, taking blood glucose level, and then also assisting with dental procedures. Number 7 was determinants of health. I definitely got firsthand experience learning how socioeconomic status influences human health. And then number 8 was program implementation. So planning, promoting, and executing those pediatric dental clinics. And then number 10 was health policy, law, ethics, and economics. So learning and putting into practice the ethical considerations of the services we provided, like HIPAA violations and things of that nature. And then number 11 was health communication. So basically communicating with patients and providers about health information. I knew I was going to get it with the patients, but I learned so much about communicating with providers. That was also really cool. So wrapping it all up, my experience at St. Mary's, like I said, was incredible. I think that the most important learning experience I had was seeing the socioeconomic determinants of health in action, seeing how if people don't have access to preventative treatment for dental care, especially how it can impact them down the road. And then my favorite part was probably getting the hands-on patient care experience and experience with providers. Least favorite part, but also very important, teeth. Confirmed that I did not want to go into dentistry and that I'm going down the right path. And then my most memorable experience was probably our last pediatric dental cleaning clinic. We had 65 patients show up. It was incredibly hectic, but rewarding and memorable. I think we were there for like 10 hours. Yeah, and these are just some pictures to wrap it all up. So yeah, it was a great time and I really enjoyed my experience. Thank you.